This month we're celebrating mental health awareness, and we are going to be talking to some public defenders about mental health awareness, how they handle stress, and what they think about mental health.
So follow along, come with us.
We recognized very early on that a significant number of people in our Dallas County jails arrested for low-level offenses were in jail not because they were bad people, but because they suffered from a mental illness. And the appropriate place for them to be would be in treatment, either in a hospital or in outpatient treatment. And so we worked with Dallas County leaders and our partners in the criminal justice system, and also in the mental illness field and the behavioral health field out in the community, to try to come up with solutions on how to divert those individuals from the jail, where everybody agrees is not the right place for people who suffer from a mental illness, into the treatment they need.
We started a program where the people who are found not guilty by reason of insanity, of course, it's generally an agreed thing. It's kumbaya, we shake hands about it. But the person, we find them not guilty by reason of insanity, and then the judge makes a finding if they are violent, which most of these are. And if they are violent, then they have to go to the Vernon State Hospital for no less than 30 days. Then they come back, and then I feel like that we should keep our hands on them and watch them. You're allowed to keep your hands on them and have jurisdiction over them for as long as the punishment range is. So let's say it's an aggravated assault, deadly weapon. That's sometimes depending what you're doing there, first degree, second degree, right? So that means that we can hang out with them, check on them, make sure they're still spruced up for up to 20 years, right? So for what I do with them is I have them come in once a month. The first of the month they come in. If Monday if the first Monday is a holiday, then they come in on Tuesday. Just check in with them and their provider, make sure their housing's good, make sure they're remaining med compliant and doing okay. Otherwise, I will hang out with them like that for once, maybe about a year. Then I switch them out to every 3 months, then 6 months, then once a year. So we have probably got about 20 people like that right now that I'm looking out for the courthouse for.
Mental health matters to me because that's our foundation. If my mental health isn't good, then I'm not going to take care of the other important things in my life.
Mental health is important because so many of our clients are in trouble because they haven't gotten the help they needed in the community to address their mental health problems. And so many of them could be helped to lead much better lives if they could get the appropriate treatment and counseling.
I think it's being mindful that there are other ways people think, and it might not be the traditional way. It could be very logical, it could be emotional, tottering between the one side to another, but it's important to be in the middle, like a wise mind.
I think mental health is so important to me and to everyone, because if you are not mentally healthy, first of all, you cannot be physically healthy. So it completely affects your total well-being. And then, I think today we bat about the phrase, love yourself. Everyone talks about loving yourself. And I think what they're really talking about is being mentally healthy. Because if you are not mentally healthy, there is no way you can love yourself. If you're suffering from depression or schizophrenia or really any type of mental illness, how do you love yourself when you are not in the right space mentally? So that's why I think mental health is so important. And if you're not feeling good about yourself, if you're not mentally healthy, you are not going to be able to give the best to your family, you're not going to be able to give the best to your job, and you're not going to be able to give the best to yourself.
I know that I'm feeling stressed when I get severe tension in my neck and my shoulders.
Some people, it is the more obvious stressors. They're crying, they're shaking, they're pacing, biting their nails. Some is just nerves about being here in the courthouse, going through whatever cases they're going through, whether they're the defendant or they're here to support a defendant or a victim in one of these cases. Some we see are just very reserved, quiet, sitting in a corner, not saying anything, not doing anything, not responding to any questions.
So how do you know when you're stressed? One way is when you can't focus, when you have too much going on, you're sending error messages.
I would generally describe myself as a bubbly individual, very cheerful, very positive. I can tell when my personality starts to be affected. Short-tempered, not wanting to be around people, knowing that there's a deadline for a project.
I can tell if there's stress, attitude, tone, from talking to them, you know, or having a conversation with them. General conversation on what they're saying to me.
Me personally, I'm a Muslim, so like I pray 5 times a day. Right now is the holy month for us. I fast. So you gotta take those breaks to sometimes just not have anything in your head and think and compartmentalize and balance, because it's stressful. So you gotta give yourself cutoff points, and just when you go home with your family, that's your family time. That's not your work time. So you have to always compartmentalize and balance, and remember the things that are out of your control as well. And you have to be okay with the fact that everything's not gonna go well.
I work out at Orange Theory Fitness, and every now and then I bust out a dance like this, like this, like this.
I like to exercise, I like to eat healthy, and actually helping my clients helps relieve some stress, helping other people, getting out of myself.
What I do to de-stress, I enjoy writing and dancing.
Take a deep breath, use your breathing skills. 1, 2.
I just take a breath, put on some music, put on some lavender or peppermint, have a nice cup of coffee, dig deep, and get to work.
You know, journaling, exercising, meditating, prayer, whatever works for the individual, or even if it's just like walking around the office just to get you out of that headspace, even for a split second.
Take a step back, take a breather, reprioritize everything, and come back refreshed, and everything will be fine. Take small bites.
I think that when properly administered, it helps stabilize the client so that the pressures of life and their mental health issues are not the driving factors. I believe that when they're over-medicated, you have people that are lethargic and can't engage in life. But I think when properly done, it just kind of evens them out in such a way that we can do the work that we need to do to move a case. What do you think?
Well, I've noticed, of course I'm less experienced than you, that sometimes the medication is absolutely miraculous. I'll have a client who I basically saw in his cell, naked, completely incoherent, dancing, unable to converse, just lost within himself. And when they start medication on the individual, I've seen within 2 weeks, the person very normalized, asking for materials to read in jail.
It is becoming all too common that our misdemeanor courts and our felony courts are seeing a large number of people booked into our jails with a mental health diagnosis, which is a strong indicator that mental health is a serious condition that we need to pay attention to. It's important for those people who are diagnosed with mental health issues to seek services in the community with your various agencies such as Metro Care Services, IPS, Child and Family Guidance.
I think as it being a social issue, everyone should be aware of it. Everybody has a capacity to do their best, and we all should help each other out when we see a friend depressed or anxious, and maybe teach them some of our coping skills that we have used.
To some degree or another, all of us could be a mental health patient or a mental health client. I mean, every single one of us have to stay balanced. And to me, that's what mental health is it's staying balanced. You have to stay balanced physically, mentally, emotionally, spiritually.
Overall, yes, I do think it is becoming a serious issue because a lot of people do not like to discuss it, and a lot of people do not like to acknowledge it. So with that being said, you have mental health that is becoming extremely challenging, and people are going to desperate measures to try to cope with it, whether it be substance abuse, whether it be alcohol, and having suicidal thoughts. So definitely it's something that, you know, if you feel like you're having any type of ill emotions and things that you're unable to cope with, I definitely encourage individuals to seek some kind of help, whether it's counseling, support groups, even talking to a peer. Those are helpful things that you can also engage in different things that are cost effective, such as meditation and breathing techniques. It just requires you to reach out to someone, and someone always knows someone else. So.
Why is mental health important and essential today? Well, here's why. Many years ago, there was a commercial that was on TV that said, a mind is a terrible thing to waste. Well, even more importantly, a mind is a terrible thing to lose. Without mental health, without being in your right mind, or as old folks would say, sound mind and body, the rest really doesn't matter. What's essential for mental health is to remain active. If you have been diagnosed, to take your medications, to make sure that you're medication compliant, because it's not just about the individual. This is also about your family and those around you. Because even though you may be impacted and you may be symptomatic and not know it, your family members know it. And they're quietly, sometimes loudly suffering as they watch their loved one deteriorate and slip away into madness. So that's why mental health is important today. And I hope you find this information helpful.